I'll never do this way. But it doesn't mean I'm right or wrong. This is my way, and I like to get the general idea, first of all. Because while I'm reading, I will catch things. I know how to read and catch the important things. Then I reread it again. It's easier for me. I don't stop at any point. But then when you stop at a point, it's not clear for you, leave it and come back to it. But highlight it, it's not clear. I mean, it's better for you. Can I have the... Oh, don't worry about exam, honestly. But you need to close the... يعني don't worry, just don't make your worries only that you want to study to get good at your exam. It's more important to see a good physician that they understand what they are studying. Best of luck. Is it clear for you? And I don't see from here one. Is it clear? Well, I need to close. Better. Best only this side. طبعا you're lucky you're not on campus. Usually 9 is 9. I don't allow anyone 5 minutes later. It's a matter how we really... I will not say anything at the beginning, but if it's on campus 9 والله 9 5 ما حدا بيدخل. خلاص done. Now, let me tell you, Dr. Dilip, I think he gave you before yesterday a lecture. It's a general one. But now let's start off what does it mean, pharmacology, and what you're expecting from pharmacology from the beginning till the end, till you are graduating. Well, this will go and go and go, and you'll be asked about medication, and, contraindication, precautions, and you take it like a general concept. Now the concept, you have a medication. Pharmacology is the study of these drugs to the body. Again, it's the study of the body against your body, how it interacts with the drugs, and what the drug should give you an effect. So it's study of effect of drug on function of living system, okay? It's not synonymous of pharmacy. Pharmacy has nothing to do. Pharmacy, it's a college. Pharmacy, it has the pharmacology, a part of it, and it has other pharmacognosy, industrial, and other things. So pharmacology, it's taught by the College of Medicine and the College of Pharmacy, by the way. Another one, pharmacology, whatever you're taking, is scratching the surface only, by the way. What's given to pharmacies, they are the one to give you all, they will be given all the details. Now, what are the two main areas as for you as a physician? What do you need to know? It's pharmacokinetics and pharmacodynamics. What does it mean? This is from the beginning till the end. For you as a physician, what do you need to know? This medication, if you are giving to a patient, what will be the effects? Is it increasing heart rate, or you want to decrease the heart rate? Okay. So we know that this is, what does it mean? It's the dynamic things. I mean, this is the concept. It's increasing heart rate. This is what you need, pharmacological effect or therapeutic effect, what you're looking for. Now, the side effect, is it an effect or it's a, do you see it? It's a pharmacological effect. By the way, any effect you will see it on the body, it's a pharmacological effect. Either it will be a therapeutic, which you want to decrease the heart rate, but you will have some side effect, but this is a pharmacology effect because it's acting on certain receptor and having the side effect. So this is the dynamic. Where it goes in the kinetics, into guess if she's taking a pill or I'm taking a pill, what's happening to the pill? How the body is reacting towards this pill? What will happen? So I no need telephones. So I'm so kind and nice, but please, if you don't want to listen, goes at the back. Don't show me that you're not interested. So what do you think, what will happen if you take a medication? This is a general concept. What will happen? Let's say you're taking it oral. I'm sure from biochemistry you have something. Yes. Yes, anyone. Yes. This is what I want to tell you. Absorption differs from place to place. Yes. Distribution, is it the same in all the body? Great. Now, will it be metabolized before it gives you the action? No. So what's in the middle? The dynamic. But usually when we give the ADME, absorption, distribution, as she said, metabolism, excretion. What is the effect? So after distribution, what should happen? The dynamic effect, or where it acts, okay? And then what will happen later on? It cannot be acting and acting, it should be metabolized and then excreted. This is the normal process, okay? So whatever dose we are giving at the beginning, administered dose, remember that there is absorption and there's metabolism and then there will be distribution. And I will explain for you. It's very well calculated through researcher and scientists or pharmacists or industrial. What's the right dose? What is the therapeutic dose? And you might take 2 milligram, but they know how to calculate it. That it, at the end it's 0.5 milligram, which should give the effect. Because it goes by bioavailability. Which one it has the best bioavailability? 100% bioavailable. Which route? 100% bioavailability.
Doctor, I'm sorry to interrupt. Doctor, the microphone is here, so if you can stand here.
Better here. I forget the online. Okay, so which of the medication it's 100% not which the route of administration is 100% bioavailable? Which, yes, who said IV? Yes, the IV is the 100% bioavailable. So what we'll be studying now, the pharmacology study, it's on, I will repeat it because I was away from you guys, the online, on function of living system. And we have two main areas to, you will hearing throughout all the block. You will see, if you see our outlines, we will tell you, usually I'll give an overview of any pathophysiology or microbiology, and then the pharmacology mainly will be covering what? Mechanism of action, side effect, if there is any certain route of administration, you have to know it, or major side effects, drug-drug interaction, precaution regarding any renal failure or anything, so which is covered mainly kinetics and dynamics. Now, the kinetics, if you see in the picture, it means what your body does to the drug. Is that true? Okay. At the end is the fate of substance. It starts as a place and it should goes out from a place. So over a period of time, you have a fate of a substance will not stay in your body, or it will be what? Toxicity, or might cause in a severe side toxic effect. Okay. So as you said, absorption, distribution, metabolism, excretion, which is the ADME. What's the dynamic? So what we said, it should be absorbed, then distributed, and in the middle we should have an effect, which is the dynamics, which where what the drug does to your body. What does it do to your body? Does it increase the heart rate or decrease? And then, so where it acts now, it increasing heart rate. What should it should act on certain what? Receptors. And now, from acting from certain receptors till you see the increasing heart rate, what's going in the middle? The intracellular effect, which is the dynamic, where you will hear it, mechanism of action, mechanism of action. Mechanism of action is to increasing heart rate, but how it increases the heart rate? Cyclic AMP, decreasing cyclic AMP, intracellular calcium, and so on. This is what you'll hear it always in the blog, that the mechanism of action is acting intracellularly, extracellularly, or it should go at the DNA level or whatever. So this is where it acts intracellularly, but for you at the end, there is a biological effect. What is it? Increasing the heart rate. So I draw for you so that you understand you have a patient and they're looking to each other about the drugs. So he has to take the pill, so it should be absorbed, goes to the bloodstream, you have the drug, and then it should be distributed where? To the cells. And where's the, so the more you're specific to a certain receptors, you're making it less side effects. And let's say I have a medication that acts on a certain receptor like alpha-1 receptors or beta-1 receptor, you're going to beta-1. You're not affecting other receptors, beta-2 or beta-3 or beta-4, okay? So it's going through the blood flow to a certain receptor. What will happen? It should act on a certain receptors, and then there is intracellular effect, which is the dynamic after its distribution, and then it gives you what? Increasing heart rate or decreasing heart rate or whatever the effect we're looking for. What will happen after that? We cannot keep it increasing. It should be going to the liver to be metabolized and then eliminated, and the patient is free of drug. Is it clear, the concept? But now in my lecture, I will cover absorption, distribution, metabolism, excretion together today and next week, and then I'll go to dynamic. This is the way, usually even in the book you will have. But remember, the dynamic is in the middle. Now, this I draw it as a schematic. It just, you have an administered, please, if you have any question, let me know. Administered dose, you have the kinetic, as we said, is the rate of an extent of absorption and distribution to tissue. This is what will happen, first of all. It should be absorbed, distributed, and then it should go, when it's distributed, concentrated at a certain receptor. This is right, which is the dynamic. Coupling, as you said, intracellularly. I will talk more about it in the dynamic. And then you will have a physiological effect, a therapeutic effect. You want a therapeutic effect, increasing heart rate or decreasing the heart rate of this patient. And the toxic effect, it will be from acting on certain receptors. Do you know why?
Overdose.
No, it's not overdose. Overdose, toxic effect is an overdose, but a side effect. And you think into, you have a medication, they act, if it's not specific to a certain receptor, it goes in different receptors. So let's say this medication that decreases the pain but can cause constipation. So now your pharmacological or therapeutic effect, or what is it, is to decreasing what? The pain release, right? But what's your side effect?
If the patient has asthma, that would block the better receptors.
Yes, but then I want to give you the concept in if you certain medication and they act on certain receptors. Later on, you will know it, that like the pain, decreasing pain, okay? They cause always codeine, they cause what? Constipation. So think of someone, he's constipated, he needs to have, we want it to be used in case of constipation. What we'll be using? A low dose of codeine, okay? So that if they have diarrhea. So in case of a pain relief, we use codeine for what? For the pain. But what is the side effect? Is constipation. But in case of someone has a diarrhea, a very, very low dose of codeine is given, but it's not given for pain. It's given for what? For the diarrhea to cause constipation. So now it's a therapeutic effect, whereas when you're taking it, and because in pain, it will be in a higher dose, where in this one. So this is, remember, these all are pharmacological effect. They are acting on certain receptors. The toxic, this is where it's found in the picture. If you see that I always emphasize therapeutic effect. You cannot give a, like, if they will tell you, they will tell you, no, I will not take this one, I'll take half of it. You cannot take half of it. This is the dose. This is the therapeutic dose. Because if you take half of the tablet, if what's prescribed for you, what will happen? You are under sub-therapeutic, like the one for antibiotic. You hear them, they will tell you take one dose, high dose, 1 gram. Some of you, they will tell you, no, I'll take half. You cannot reach the therapeutic effect. Or if you double the dose, which is not recommended, where you will reach. So where always you are, for pharmacology, what are we looking for? The therapeutic, the green area. And then once they give the effect, it should be metabolized again, and you have excretion. Remember that different people, they respond differently. We will not respond all the same. First, we have some genetic factor, or later on, I'm sure you will hear that if you have mutation in certain area, you might have more side effect, or you might have less therapeutic effect. You will hear it a lot in the kidney and liver transplant. They will give the same patient the same medication, but this patient will respond great, this patient will not respond. So always now they are referring all of these changes or differences is due to genetic factor. Age, remember, the baby is different from geriatric, different from adult, different. So we have different doses. Sex, male and female. Guess if anyone has an renal impairment or liver impairment, what will happen? Will we give them the same dose if someone have renal impairment? We should recalculate the dose because they are excreted through renal, or sometimes hepatic function. If let's say if the liver metabolizes the drug in a high due to any mutation or any disease, so always in certain diseases we recalculate the dose. And then drug-drug interaction, which is the most important, other than drug-drug interaction, herb-drug interaction or food-drug interaction. Sometimes you will see at the medication what they will put for you. Do not take this medication with what? With food. Take it on empty stomach. What does it mean? It's affected by the food. So this is all, and it's more into pharmacology of a pharmacist, but you should know the concept of it. Is it clear? Now, the dynamic, I'll just touch it in two, well, already say it. You see, this is the receptors. We will go over it, all the receptor and type of receptors. We have a drug that is absorbed and distributed, and it goes now to a receptors to act, and then to give you, and this is all the blue arrow is what? The intracellular effect to give you the biological effect. So it's the study of biochemical and physiological effect of a drug and their mechanism of action at organ level, when we say it acting on the heart, and cellular level, what's happening with the heart, all the intracellular effect to give you what? An increase in heart rate. Remember, increasing heart rate, we're talking contraction, so it might be what? Calcium involvement. So this is the intracellular. Clear? Now, remember, also I will, this in my third lecture, I will cover the dynamics. Most of the medication act through what? Receptors. Most of the drugs, they will act through, but you might hear enzymes, you might hear ion channel, neurotransmitter. Do you remember how it will be released? Neurotransmitter, I'm sure from biochemistry. I'll just refresh. You have certain enzymes, and then we should have action potential, amino storage, so that at the action potential, when it comes, what will happen? You have exocytosis. Am I right? So let's say if we block this calcium channel, what will happen? No exocytotic neurotransmitter. So it's the same things for medication. If you block a channel, you might have not the effect. Now, carriers, many medications, they will affect the carriers that are bringing the neurotransmitter to inside the cell. Let's say if you have a carrier that is responsible of norepinephrine. Remember, neurotransmitters are going, when they give their effect, how they will go to the inside the synapse with a carrier, okay? So let's say if we stop the effect of carrier with a certain medication, what will happen to neurotransmitter? It will be more neurotransmitter at where? At the synapse where the action. So remember, so you have receptors, receptor postsynaptic, you have enzymes, you have channels, you have different types where effect, but mainly you will hear most of the time from us is affecting what? The receptors. Now, why it's one slide? Okay, so this is just because I will review it later. As I told you, it's the receptors, ion channels, were affecting enzymes or transporter. This will be taken more into dynamics. Now, what's kinetics? As we see, we know this is from absorption, distribution. Drugs in the tissue, it means the dynamics. Then metabolism is how the body acts on the drug, is the ADME. This is right. Different for each drug. By the way, we have difference. Not all drugs will act the same. Not all of them, they will have the same metabolism. So you will hear each drug or each family. Now, when you're talking more into pharmacology, you'll be hearing more about what's the difference between this class and this class, why this class have side effects. Whatever is written in the book, this is the mainly what we know from research, that if she takes this medication, you will have this dose is recommended, this is the side effect. But always there is variation among us. And so we have to give an adequate drug doses to give what? Therapeutic and non-toxic. This is what was telling me. We don't want to go sub-therapeutic, and we don't want to go to a toxic level. Now, this one, again, is explaining what I give you the idea. It's, remember when you say administration, I think one of your lectures is routes of administration. So if you're taking something oral, is it the same as you're taking IV? Is it taking, what's the differences?
Oral goes to the stomach,
Okay.
and IV doesn't go to the
Okay, so if we're taking inhaler, anyone is asthmatic, we take inhaler, and to the lung. So you want it to act where? You take it to the lung. So we have different routes of administration. So if you're taking rectally, and do you have like brother and sister, young, very babies, what we'll give them when they have high fever to lower the fever? Tablets or suppository? Why we give them suppository? Fast effect. So rectally, because of the blood flow is high, so more. So it differs from where routes you are giving the medications. So now, as she said, if you are talking intravascular, it goes directly to what? To distribution in the blood. Now, but most of the medication we are talking extravascular should be what? So you have route of administration. Remember, it's number one. You should take it from oral, IV, subcutaneous, or intramuscular, and then it should be absorbed. Now, from the normal process, what we are talking, from absorption, what should happen? Distribution, am I right? This is what we already agree on. But I will go with this flow 1, 2, 3, 4, 5, and I put it, this is by my hand, 2, 3, 4, 5. This is